Hello to all of the European Generic Association's delegates to the EGA meeting in Madrid on June 25th, 26th, and 27th. My name is Mark Desimone, and I'm the Chief Executive Officer of Aegate. Aegate has worked for the last 10 years to roll out and ensure a network of verifications across thousands of pharmacies, linking the pharmacies to the manufacturers of pharmaceutical products across multiple European countries. Our practical experience has already shown how we can operate across multiple pharmacy software vendors and linking this service so that the pharmacist does not get distracted in his workflow, but is alerted when a tag is read that meets certain criteria. So particularly clearly as the serialized pack standards comes online, the ability to recognize a falsified pack or an expired pack or maybe a stolen pack. This is practical experience. We have read over 3 billion tags to date, and we're reading 250,000 tags an hour. So our systems have scaled, have seen all the contingencies of what if the network goes down. Can we work with different operating systems in terms of PMR software? Can we work in different countries under different legislature? And more importantly, can we take in tags that are not yet standardized to a single European model? But can we work with the current industry structure from tags production, and then over time move to the standards as the standards emerge? So we have worked at the problem bottoms up, not top down. We have also invested 65 million euros to get this system up and running, and the latency, the time that the scanning requires to go in as a verification and come back is less than 200 milliseconds. So it's something that the pharmacist doesn't even perceive, so it's in the background and only used when needed. This is not a pilot, and unlike other industry efforts that have designed systems through committees, this is a very practical, low-cost effort, because we have operated this for 10 years. Actually, 7 years has been running. For 10 years, of course, the company has been in existence, and our cost curve, by definition, is the lowest in the industry because we have had the greatest accumulated experience in this. In fact, we're the largest company in this field. We've worked with 30 or 40 PMR vendors to date, and we understand the complexities of having to deal with a very heterogeneous European market with different country models, with different mixes of pharmaceutical companies in the countries that have authorizations, with different pharmacy sizes, with different pharmacy concentration, pharmacy network concentrations. We work with wholesalers, with parallel traders. We have understood in detail what it would take to scale the model that already has over 10,000 pharmacies connected to the 170,000 pharmacies across all the 28 or 33 European countries. We're there at the conference. We hope that you can come and visit us, that you can see the practical experience, and that you can see how there is a clear ability to monitor the performance of the entire system and ensure quality, security, reliability, scalability, and more importantly, a service that does not disturb the regular processes at the pharmacy or, in fact, with the manufacturer, but really addresses the issue with practical implementation. The costs that this industry will have to face are not the cost of the system only, but clearly they are the cost of the changing processes that manufacturers, the pharmaceutical companies, may have to do over time. Now, this could be an opportunity or a threat. We think for the pharmaceutical industry is an opportunity to have and leverage in this system once it's connected, and simplify the way the tagging process goes across multiple European countries. Again, we salute the generic associations, the European Generic Association's strategy of rendering the cost structure for distribution of pharmaceutical products the lowest possible. We think it's a wise model, and it's a wise model for the generics as well as for the branded products. So we look forward to working with you. Come and visit us at our stand, at our booth, and hope we can meet during the presentation. And if you see me, stop me in the halls and let's have a chat. Thanks a lot, and have a great conference.